You know, for 5 months, I was talking with our program, our regular Monday program with Dr. Lucas. And I want to say, just a personal note, after my first introduction to her, as I was starting out that 5-month period hosting Coastal Daybreak, the first thing she said to me was, "You need to eat more eggs." And I want you to know, Dr. Lucas, that every morning, ever since then, I'm having 2 eggs, just because you said you need protein in the morning. I just make mention of that, just a personal comment.
And you're not sick of them yet.
No, absolutely. Although it's getting a little pricey these days, but anyhow. All right, we've got Dr. Lucas joining us this morning. We're talking about high blood sugar. You know, well, how about that? That's one of those things you were telling me. That what we eat in the morning generates what basically is going to happen to us the rest of the day. So.
Yes, and especially with people with diabetes. So it makes it even worse if you eat cereal versus eggs, because cereal makes the sugar go high. So we want to talk about what this sugar does long term. High sugar.
You know, again, I go back to what you said to me, protein. You insisted that I should have protein first thing in the morning. The relationship protein between that and sugar, just for a quick second.
Well, protein doesn't make your blood sugar go up. So if you eat eggs, your blood sugar stays the same between breakfast and lunch. If you eat cereal, your sugar goes really high and then drops before lunch and you're starving by lunch or even halfway through. And it makes you want to eat more.
That was the point I was going to, because you told me then, you said, look, protein, your body does not crave sugars, and you actually use the fuel longer period of time.
Right, carbohydrates in the morning, pancakes, waffles, cereal tend to wear off in 2 hours, so you're hungry in 2 hours, even for people without diabetes. So.
Okay, so I'm talking as a client of yours. Let's talk about this. What impact does high blood sugar have on the body over a period of time?
Well, if you think about pouring syrup on pancakes and how it sticks, and if you get syrup on your finger, it sticks and just stays there. That's the way the sugar does in your blood. So if you have high sugar, it's like syrup in the blood vessels. So it sticks to everything. It sticks to the walls of the blood vessels. And that's what causes most of the complications of diabetes. It also sticks to a lot of other things, but mainly blood vessels, because that's where the blood sugar is. It's not getting into the cells, it's hanging around the blood because it can't get into the cells, either because you don't make enough insulin or the insulin doesn't work right. So when it does that, it creates plaques in the arteries and in the small blood vessels. So the types of complications you can get either involve large blood vessels such as heart attacks and strokes, those are larger blood vessels, or the little teeny blood vessels like in the kidneys and the eyes, which are can be damaged by the high sugar.
And that's one of the manifestations, is it not? You lose damage to the eyesight and damage to the extremities?
You can get also nerve damage, and nerve damage is when the sugar actually sticks to the nerve endings. So that causes the tingling and numbness in the feet usually first, because that's the furthest away. The smaller the nerve, the quicker it gets affected. And you can have dental problems, you can have all kinds of problems. You can have joint problems from diabetes, from sugar sticking to the joints. You can have teeth problems and gum problems from sugar being in your mouth and your gums, creating bacterial infections. So there's a lot of range of things that are caused by high sugar just sticking to everything.
Now, a lot of people who may not think they have diabetes, and we here at the station know of someone with that specific situation. What are some of the manifestations? I mean, early on, are there things that sort of begin to kick in that you start saying, well, maybe there's something wrong here?
Well, if you feel thirsty a lot, going to the bathroom a lot, getting up at night all the time to go to the bathroom with large amounts of urine, not just small amounts like prostate problems. If you feel sleepy after eating, and especially if you eat starches or sugars and you start getting sleepy, that's usually because your blood sugar is going up. It has nothing to do with bananas. It has something to do with sugar going up after eating. Or if you feel sleepy after a meal and then before the next meal you get shaky and starving, that's when your sugar going up and then down. That's one thing that people that is real early on that people may have, not necessarily have, and they may not notice it. Maybe they think they're just tired in the afternoon or something. But that's one thing. Also, if you've gained a lot of weight in the middle and the belly fat has increased, that sometimes comes before you get diabetes. sometimes you lose weight unexpectedly, and that's when your sugar is really high. You start craving sugar, drink sugar, urinate a lot, always thirsty. So those are things. Women get yeast infections more frequently than men with the high blood sugar. So those are some reasons or some symptoms.
Now this is cumulative. So in other words, as it just continues
As it continues to increase, you get more and more symptoms. Some people have no symptoms or they don't think they have symptoms, but then when they're finally treated, they feel a lot better. They're not as tired. They just feel better in general. And probably because they're getting better sleep because they're not getting up all night and go to the bathroom.
Okay. And then in the process, well, I want to come back to this in a few moments. How can this be, can it be reversed, and the prevention thereof?
Yeah, the chronic complications, which I just listed, all those things. If you keep your A1C under 7, so that's an average sugar over 3 months. That's what your doctor does in his office. Maybe drawing blood or finger stick, checks your hemoglobin A1C. And so that's like a report card for the last 3 months. And so if you have a good one, then you're less likely to get complications. But if you have a bad one, you need to work on it so that you can get it down. Because that, if it sticks to the red blood cells, which is what the A1C measures, it's going to stick to everything else. So it's a monitor of what's going on in your body. Because the sugar sticks to the red cells, it doesn't readily come off of them, it just sticks there.
Uh-huh.
And you can measure the percentage of red cells that have sugar stuck to them, and that's what the A1C is. The other complications like heart disease, the big blood vessel complications, of course, are also related to other things, high cholesterol, high blood pressure, family history. People with diabetes should not smoke because smoking constricts all the blood vessels in the body, even the small ones. So people that smoke and have diabetes have more blood vessel diseases, heart attacks, peripheral vascular disease, and retinopathy and nephropathy. So smokers they need to quit, for sure.
So in essence, smoking just really exacerbates the problem.
It does. Especially if you have any kind of eye damage or kidney damage, because if you constrict the blood vessels that are already have plaque on them, you're not getting much blood flow to the area.
All right, and again, go back the description very quickly as we go to the break here, that when you're talking sugar, you're talking about the same concept as if it's syrup.
Right, and that's what you have to think about it.
Well, I mean,
people think it's funny when I say, pour syrup all everybody, but it's inside your blood vessels. That's what the sugar does when it's floating around.
All right, Dr. K. Jean Lucas, our guest this morning, of course, program brought to you by Diabetes and Endocrinology Consultants, online at beachdoctor.com with Dr. Lucas. Stay tuned for more here on the Coastal This morning. Of course, Dr. Lucas, Dr. K. Jean Lucas with Diabetes and Endocrinology Consultants, and online, by the way, beachdoctor.com, beachdoctor.com. Let's talk about this issue of diabetes now insofar as prevention. And I'm going to ask the question, you've told me in the past, can you reverse it?
It depends on what phase you're in. If you don't have diabetes yet, there are medications that help, like with pre-diabetes, that actually fix a lot of the problems.
Okay.
But you have to get treated before you actually get diabetes, because by the time you get diabetes, half of your ability to make insulin is gone forever. And it's a genetic disorder, so it's unlikely you're going to permanently prevent diabetes with a genetic disorder. You have to really work hard at it, and it's hard for people to do that with a genetic problem. So changing your genes would help, but there's like 300 genes that cause type 2 diabetes, and type 1 is not genetic most of the time. So what we want to do is keep everything controlled, blood pressure controlled, cholesterol controlled, stop smoking, and work on the A1C. The A1C needs to be less than 7, the lower the better, but less than 7 seems to be the cutoff from when you get complications. So 7 is 150 average blood sugar, which is still too high. That's not normal, but that seems to be the cutoff phase for getting complications and not. You want to keep your belly fat under control, 40 inches around the belly, not the waist.
Okay.
Around the belly for men, 35 inches for women. So that's a lot, Some people it's hard to do that because genetically you're prone to gain weight there.
Especially as you get older.
Right. And then you want to see your physician every 3 to 6 months to check the A1C, and also check your cholesterol and blood pressure and make sure all those things are under control. You want to exercise and, of course, eat right as usual.
exercise and eat right. Now, before we wrap things up here with Dr. Lucas, Eastern North Carolina in general, but Eastern North Carolina has a high incidence of diabetes, does it not?
Yes.
So it's important, folks, listening to this, to take this this observation seriously.
Yes, for sure.
Is it related to diet, or is it, I mean...
Well, genetics.
Genetics?
Yeah.
All
It's
right.
the genetics of certain groups of people, and it's environment, for sure. If we were all still farmers and working the land and doing a lot of activity, you could eat whatever you wanted. But we're not that anymore, and then food has become so plentiful and full of fat and starches that it's hard, and people are eating out more.
Dr. K. Gene Lucas, of course, with Beach Doctor Diabetes and Endocrinology Consultants.